One of the most difficult things that we deal with, that I deal with on an everyday basis, is the question of insurance. Patients have a misconception when it comes to dental insurance because it's not like medical insurance. Medical insurance can be such that it'll pay for everything, or the majority of things after you pay your deductible. In dentistry, I liken it to haircut insurance. It's almost like you get so much money and you pay so much money and it sort of pays for itself. You know, an employer pays X amount of dollars and the patient only gets a little more than that back. A patient can't purchase their own dental insurance. So when it comes down to it, you get $1,000 a year, which hasn't changed since 1970 when insurance first came out. $1,000 in dentistry doesn't buy a lot. So a patient says, I have insurance, do whatever you want. And I said, well, you know, it'll pay for 1/10 of what you need. It's a hard thing. So the first thing, I have to help patients understand that this is their health they're dealing with. You know, you don't want to, you can't skimp on it. Now, we don't have to do things you know, in the most ideal, I don't want to say in the wrong way, but in the Cadillac way. You know, you can approach things in different ways. You could phase treatment in different ways. But there's a way of looking at and maximizing insurance so I can help you as a patient get the most out of your $1,000 or $1,500 benefit for the year. But I have to help you to understand that you have to value your health. You have to value that tooth, that you don't want to lose that tooth. It's not just a tooth, because you lose one tooth, you lose another. Pretty soon you're smiling and there are holes in your mouth and you can't chew properly and you can't digest your food properly and all sorts of things happen. So I have to help you to understand that, you know what, it doesn't pay for it, but insurance shouldn't be your reason or your means of deciding on your care. Sometimes you'll have to put your money in your pocket, like you do when you go to a fine restaurant versus going to a fast food place. You make a decision to spend $100 on dinner instead of $5 on dinner. So you have to understand that you'll have to make a decision to keep your health to a certain level, and that's my job to help you. So it's an educational process, but it's also helping to work within your means and to make care affordable. What we did in our practices, we've put forward a program. It's not insurance, but it's a contract program. It's a program where you become a member of Bay Dental Health's care group. Mm-hmm. So we have patients pay a certain amount of dollar per year, very low entrance fee, and then on a monthly basis, a small monthly payment, which gets them work at no charge, such as cleanings and exams and things like that over the year, at no additional charge. And then on top of that, they have a 20% or so courtesy off of regular fees. So it's almost like a 20% insurance plan, even though it's not insurance, but that's self-administered by our practice. And we work with other things that help make care affordable. So really what it comes down to is taking the insurance thing and making it into an affordability and something that a person can budget in terms of doing and working with over time.